This is a work we're presenting in a poster today, summarizing 106 patients across 12 sites in Israel who got Belantamab Mafodotin as part of the early access program. And so we show these patients were really quite heavily pretreated patients. They mostly, about 70% of them were triple class refractory patients, and most were refractory to the last line of therapy that they received. So it was really encouraging to see that the results in this real world cohort are similar to those in the clinical trials. So in the real world, we were able to show that really this is a manageable treatment. As far as the safety, we did see the same ocular toxicity that was experienced in the trials. Around close to 70% had ocular toxicity, but it was mostly reversible and mostly manageable. So only 4 patients out of these 106 patients had to actually discontinue treatment because of this toxicity. There were dose delays. About 56% of the patients experienced a dose delay. However, when we looked to see if this affected the efficacy outcomes, we did not see any deterioration in the outcomes in those patients. We looked actually at dose density over time. As far as efficacy, the overall response rate was quite encouraging. It was 45%. The progression-free survival was 4.7 months, and the overall survival was above 14 months in these very heavily pretreated patients. And when we did a responder analysis, we found that the patients who responded, the overall survival was not reached. It was only 7 months for those patients who did not respond. So this also shows that this intervention indeed was making a change in the outcomes of these patients. So all in all, I think it's really supportive to have a large cohort. I think it's one of the largest cohorts that was so far published, confirming the results of the DREAM2 trial.